Major depressive disorder is one of the most important psychiatric disorders. They'll love to ask about it in exams, and you will see it frequently in the clinical practice. The patients present with symptoms that are often subtle and hard to diagnose. But once you know the diagnosing criteria and the symptoms, you can easily look for them and spot them quickly. To remember the symptoms, remember spaced digs. So sleep disturbance, and this can either be sleeping too much or too little. Psychomotor retardation, which is basically having slower thoughts and inability to think quickly or rapidly. The patient will take much longer time to process simpler information. Appetite change, and again, just like sleep, this can either be increase in appetite or decrease. Concentration loss. The patient will complain that they cannot concentrate on something for a very long time, and especially in exams. Energy loss, and this is often the main complaint of the patients, along with depressed mood. Having low energy will give you depressed mood, and having low mood will also give you low energy. So the main complaint of patients is often one of two, either decreased energy or decreased mood, or a combination of the both. Interest loss. The patient will tell you that you used to be interested in something in particular, but they're no longer interested in it. Guilt. And keep in mind that the feeling guilty is often a normal reaction to most people. But feeling guilty for stuff that you shouldn't feel guilty about is a symptom of depression. Like feeling guilty for something that is out of your control. And of course, suicidal tendencies. To make the diagnosis, the patient has to have 5 of these symptoms for at least 2 weeks, and this has to affect the patient's lifestyle. And this is the diagnosing criteria. So think of inability to continue the lifestyle as usual, and we call this functional impairment, for at least 2 weeks with 5 of these symptoms. Use the link below to get access to the full Mnemonics course. In this course, we will discuss all the important high-yield topics that we see everywhere in the clinical practice. These topics are especially important for healthcare providers. We cover topics like the treatment of acute heart failure, tension pneumothorax, and other